Magandang araw po mga kasambahay and welcome to another very special episode of your favorite multi-award winning health and medical program. Ito po ang Doctors on TV and today we are here at the very beautiful St. Luke's Medical Center in Quezon City. My name is Dr. J.M. Ko. I'm an internist and an endocrinologist. Joining me today, my favorite dermatologist, Dr. Casey Reyes.
Thank you, Doc.
Hello, Dr.
So this is a very exciting topic because it's not very common, the procedures that we're going to talk about today.
Correct. So actually, we've been doing this for several years.
Yes.
Ngayon lang natin pag-uusapan ang wound care.
Yes.
Okay, so very interesting for our audience.
And very common, di ba?
Kaya huwag kayong aalis na. It's really a very informative and productive episode. But before we proceed, we'd like to invite you to join us in our social networking sites. Please like us on facebook.com/doctorsontv. You can follow us on twitter.com/doctorsontv, and you can watch us live streaming on the internet wherever you are in the world. UNTVweb.com. Naka-upload din ang mga past episodes natin.
So katulad po ng nasabi namin kanina, we have a very exciting topic which is wound care. So please watch this video.
Humigit kumulang 3 milyong Pilipino ang may diabetes mellitus. Kabilang ito sa 10 pangunahing sanhi ng pagkamatay ayon sa World Health Organization. Ang diabetes ay isang uri ng sakit sa lapay o pancreas, bahagi ng katawan na gumagawa ng insulin, isang uri ng hormone na nagpapababa ng asukal sa dugo. Taon-taong ginugunita ang World Diabetes Day tuwing buwan ng Nobyembre upang isulong ang awareness sa sakit na diabetes, upang turuan ng publiko sa pag-iwas dito, mga panganib, mga komplikasyon at ang pangangalaga at gamutan ng mga pasyente. Isa ring sintomas ng diabetes ay ang mabagal na paghilom o paggaling ng sugat. Ang simpleng sugat ay isang potensyal na portal ng mga harmful germs na maaring maging sanhi ng mga karamdaman na posibleng mauwi sa amputation o pagputol ng isang bahagi ng katawan. Kaya samahan kami ngayong umaga, ating talakayin ang isa sa epektibo at modernong pamamaraan ng pangangalaga ng sugat o wound care, kasama ang mga experts, Doctors on TV.
To help us understand wound care better, we've invited a specialist from St. Luke's Medical Center.
Yes, we're truly honored to be with you, Dr. Efren Capistrano. He's the head of Complex Wound Care Center and the chief of Division of Wound Care, Institute of Surgery, and also an assistant professor in St. Luke's College of Medicine, and member of Rapid Response Team of Institute of Surgery, and member of Acute Care and Trauma Surgeons. Oh, sir.
Wow.
Lots of
Hello, sir. Thank you for joining us.
Oh, it's my pleasure.
Yeah.
Thank you too for inviting us here.
So, Doc, we'll be talking about wounds and wound care. A lot of us get wounds every day. May mga maliit na sugat, nababangga kung saan-saan. Ano bang kailangan ng katawan para gumaling ang isang sugat?
Mahalaga, kailangan nating malaman kung ano yung dahilan muna ng sugat.
Oh.
Doon natin malalaman kung ano yung kailangan ng sugat kasi yung dahilan. So the etiology of the wound is critical to the management of the wound.
Okay, what if it's just a simple wound? Nabangga mo lang yung paa mo somewhere, nagka-laceration.
Yes. So like we deal with that trauma, so we define it as acute wounds and we try to differentiate that from chronic wounds kasi.
Okay.
The management of acute wounds can be very different from chronic wounds.
So acute muna tayo, Doc, before we proceed to chronic. How do we handle acute wounds? Kailangan ba wash, malinis?
Of course, the most important preventive measure, if it's just superficial, common household wounds, is cleaning with basic soap and water. And essentially, you can use anything you have at home that is clean to cover it.
Okay.
And then later on, after that, the doctor now can define the appropriate dressings that the wound may need.
Okay. How would you know kung kailangan mo pumunta sa emergency room para tahiin yung isang sugat?
Pagka yung mga sugat, kunwari labas yung mas malalim na bahagi ng balat, labas yung taba, yung muscle, so siyempre mas malalim doon, pangkaraniwan kailangan tahiin talaga yan. At yung ibang karamihan ng sugat, siyempre pagka medyo mas patuloy yung pagdudugo, ang mahalaga naman doon ay takpan lang agad, apply pressure, pangkaraniwan, maipipigil na yung pagdudugo na yon. hanggang makarating sa doktor o sa emergency room.
Doc, with acute wounds, what's the best wash that you can recommend? Ingredients? I mean, like, agua oxinada po ba? Or chlorhexidine?
Sa amin siguro ang pinakamahalaga dyan is simple tap water, soap and water. Now, if you're going to use an antiseptic, we have chlorhexidine, povidone iodine. Actually, they work best. They're generally for external use. So, we apply very limited antiseptics into the wound base itself. Hydrogen peroxide is so common, but unfortunately, it's the poorest of antiseptic. So, we rarely use hydrogen peroxide anymore. Essentially, we sometimes use it to soften clotted blood on wounds.
Yes.
But for a specific antiseptic, it's not helpful, and in fact, it is also what we call cytotoxic. So a lot of antiseptics may be cytotoxic, so we have to be sure that their concentration is appropriate for a wound.
Minsan nagkakaroon ng infections ang sugat. How do we avoid these infections? At sino yung mga prone talaga magkaroon ng infection ng sugat?
Ang pinaka-prone, of course, alamin natin kung paano nagkasugat. Yung mga trauma, generally talaga madumihan kasi accidents, gasgas sa kalsada, sa sasakyan. It happens, accidents happen. So I think to avoid infection, if you can clean the wound, cover it until you can get to the emergency room, that's the best way to at least initially temporarily manage the wounds.
Do people need a shot of, for example, tetanus pag nasugatan sila?
Yes, of course, if it's very dirty and especially if there's contact with metals, that's a standard treatment. Unless, of course, they've been given prior immunization, especially for adults, if they have had prior immunization, for example, over the past 5 years, maybe the booster dose may not be necessary. If the history is uncertain, we routinely would still give it as a prophylaxis to be sure.
When is the best time to apply topical antibiotics, and when is the best time to take oral antibiotics for the wound?
Self-medication, of course, we want to avoid that because any form of self-medication, whether topical, more so oral, because you deliver a higher dose, may just engender the possibility of antibiotic resistance. But maybe in few selected cases, like they're far from a hospital and they have the available antiseptic, because there might be delay before they can get into a emergency room for proper treatment, a mild antiseptic probably will do with a clean dressing. I would usually want it simplified so that, like we have seen sometimes patients put molasses, they put stuff probably from traditional practices, and sometimes they may do more harm because once we see them in the emergency room setting, sometimes those are the first things we want to remove as foreign bodies. And at the same time, we are not able to evaluate the wound properly if there are certain creams, ointments that are on the wound, and we need to assess the wound base.
Dok, we move on naman to chronic wounds, yung mga sugat na matagal bago gumagaling. Sino ba yung mga prone sa chronic wounds and mga infections also?
Maraming klaseng chronic wounds. Probably I'll mention the four most common. One is, of course, diabetic foot ulcers. We can have pressure ulcers also. And then we have the two common vascular ulcers that are arterial ulcers and venous ulcers. These are the most predominant chronic wounds, although there's still a longer list of chronic wounds that we can have.
Ano ba yung processes that lead up to these wounds? No?
Well, probably if we go to the more common one, which is the diabetic foot ulcers, of course, these are usually secondary to oftentimes undiagnosed or patients are unaware that they are diabetic. Oftentimes, the diabetes may have been with them for 8 to 9 years already before the earliest symptom of diabetes may become apparent. That would be usually neuropathy. The patient have to have a strong awareness of this possibility, knowing that diabetes is a lifelong condition.
Kailangan natin i-emphasize yan sa mga kasambahay natin. No? So maraming talagang pasyente na may diabetes, hindi nila alam na may diabetes, wala talagang naramdaman. Pero yung asukal na nasa dugo nila, unti-unting sinisira yung katawan. Lalo na yung mga ugat. na nagdadala ng dugo sa paa.
Totoo ba yung Doc JM na before ma-diagnose yung diabetes, 10 years before ma-diagnose, meron na siyang diabetes?
Okay, so even as early as 10 years, the pathophysiologies that lead to diabetes nag-uumpisa as early as 10 to 20 years before the onset of the high blood sugars. And some patients pre-diabetic pa lang may mga complications na nakikita sa mata, minsan sa nerves. So kailangan talaga nagpapatesting for diabetes at the age of 45 and above, but if you're overweight at a younger age. Kasi yung mga complications dumarating na lang after mga 5, 10, 15 years, minsan malala na eh. So I guess we have to control that really. I've seen a lot of patients with diabetic foot wounds, and it's really very hard to treat pag advanced na yung foot nila.
I would just like to add, for diabetes kasi, there are some skin diseases because of diabetes. Number one is acanthosis nigricans, which is very common due to insulin resistance. You produce more pigment. And then second is diabetic dermopathy. Usually yung mga plaques na nakita yun sa shin area.
Correct.
Tapos meron din tayong necrobiosis lipoica, which is very common for diabetic patients.
Usually mga type 1 na may necrobiosis.
Yes.
I think we have to be careful with our skin. It's very important. Minsan pag nagkakasugat, napapabayaan, nagkaka-infection. And in our diabetic patients, actually leads to amputation. And we're having a very lively discussion on foot wounds and diabetic infections. But before we proceed with the discussion, pag muna kayong alis mga kasambahay, magbabalik po ang Doctors on TV.
Up next, our skincare expert will show us the latest in treating skin hyperpigmentation called acanthosis nigricans, while learning more about wound care and the latest in wound healing management when Doctors on TV returns.
Mga kasambahay, ako po si Dr. Casey Reyes for another episode of Skinling. Ang topic po natin ngayon is acanthosis nigricans. Ano po ba acanthosis nigricans? Ang acanthosis nigricans po, it is the darkening or pangitim at saka po thickening or pamumuo ng mas maraming layer ng skin sa isang part ng body. So usually po, nakikita nyo po yung pangitim at saka pag-thicken po ng skin sa mga folded area ng skin, like sa underarm, sa back ng neck, and sa groin area. One of the benign types of acanthosis nigricans is pseudoacanthosis nigricans. Kaya po siyang tinawag na pseudo, it's because it's not really acanthosis nigricans. Number one cause po nito is obesity. Pag medyo po mataba tayo or on the heavier side, nagkakaroon po tayo ng insulin resistance. So, nagkakaroon po ng pigmentation sa folded area such as the axilla, back ng neck, and even sa groin area. So, meron din naman po tayong hereditary acanthosis nigricans. Ito po nakikita na during infancy and childhood. And common po siya sa African-American descent. Meron naman po tayong tinatawag na malignant acanthosis nigricans. Usually po, may mga malignancy like 90% of patient with gastrointestinal cancer nagkakaroon po ng acanthosis nigricans. So, sign din po siya ng malignancy. But not all the time. Most often po, ang acanthosis nigricans, nakikita po siya sa benign types, not the malignant types. Usually po, ang treatment for acanthosis nigricans is just for aesthetic purposes para po mawala yung pigmentation. So, pwede po tayong mag-start with topicals. We put topical retinoids and topical alpha-hydroxy acid that will exfoliate the dead skin cells. Nandito po si Denny. Meron po siyang pseudoacanthosis nigricans and we're going to use a 1064 nanometer laser, which is what we call clear laser, to target the pigments para po mabawasan yung pigmentation sa back ng neck. So, this requires at least 5 to 10 session po. So, our next procedure is Kukil peel. This is where we combine different alpha-hydroxy acid. This alpha-hydroxy acid po it will help remove or shed off the dead skin cells para mas maging malighten yung color ng skin. So, we'll start na. Marami pong salamat. Sana po marami po tayong natutunan sa episode po ngayon ng Skin Link. Ako po si Dr. Casey Reyes. If you have more questions, you can contact me at Luminous Skin Clinic. Our hotline number is at 02511-8500 or at 0915-979-4661. You can also check us out at our Instagram page. It's at luminous_official or Facebook page at Luminous. So magkita-kita po ulit tayo sa next episode ng Skin Link.
At nagbabalik mga kasambahay ang Doctors on TV. And we're still here at the St. Luke's Medical Center in Quezon City at the Wound Care Center with wound care expert Dr. Efren Capistrano. And also now with Mr. Salvador Zuniga. Siya po ay isang 64 years old na diabetic for 27 years. It's just a bit too graphic pero sasabihin natin meron tayong sugat na hindi gumagaling. May infection din yung sugat ni Mr. Zuniga. So how do we assess patients when they come to you with foot wounds or infections?
Actually, what we have here is what we call the transcutaneous oxygen measurement.
Okay.
It's a important measure for determining whether the hyperbaric oxygen therapy, which Mr. Juriga will need, will be effective for him. Considering the time and cost that will be invested in the hyperbaric, we want to make sure that the oxygen therapy will be benefiting him.
And as I understand, St. Luke's lang ang meron ganitong machine, no?
Yes, it's a very important instrument, especially for those who want to go through hyperbaric oxygen therapy.
Okay. How does the machine work, no?
Well, we have already the electrodes connected to our patient, and there is a battery that essentially heats up the peri-wound or the tissues around the wound bed that will now start to heat up and then release the oxygen at tissue at the site. So it's not like ABGs, which will be an indirect measure. This one will measure now oxygen levels directly at the tissue level, that is around the wound where the electrodes are placed.
So hindi lang sa dugo, pero talagang at the tissue level yung measurement of oxygen. Okay.
And it's non-invasive. These are just like ECG electrodes that are put on top of the skin.
So, I'm sorry we cannot show it. Just for graphic reasons, medyo hindi po maganda yung sugat ni Mr. Zuniga. But we've already placed the electrodes. So, anong findings natin sa paa ni sir?
Well, here, it's very sensitive. That's why if Mr. Zuniga would be moving, it affects the values. But obviously here, if you take a closer look, we place 3 electrodes, 1, 4, and 2. The 2 is the one that is most distal. And you can see it is now reading 29 to 30. It's less than 40 millimeters mercury.
Okay.
And that is consistent with our monofilament test done earlier, which shows that Mr. Zuniga not only has significant neuropathy, but to some degree has some beginning ischemia also.
So, hindi lang barado yung mga ugat, pati yung mga nerves niya, medyo may kahinaan na rin compared sa dati.
Yes. And then after this, after the oxygen challenge, usually we will see a significant rise in the oxygenation of the tissues around the wound bed, and that will now define the value of hyperbaric oxygen therapy.
Okay. So, is Mr. Zuniga a candidate for hyperbaric oxygen therapy? No?
Yes, definitely. I think Mr. Zuniga will benefit from hyperbaric oxygen therapy. He has to invest probably at least 4 weeks of treatment, 5 days a week.
Okay. How else do you advise patients on taking care of their wounds at home? Proper dressing, how to avoid infections?
Of course, this has to be well coordinated with their wound care specialist, because wounds, you have to know the etiology. Like in diabetic foot, since there's a metabolic problem like diabetes, it has to be controlled. The wound now has to be assessed in terms of the wound base, the wound edge, the amount of exudate, determining if it is infected or ischemic.
On a daily basis, how do you advise patients on taking care of their feet? Pwede ba sila mag-shoes, mag-socks?
Yes, actually, our center provides free copies of foot care and nail care. It seems very basic, but I think we can save a lot of digits and limbs by just practicing appropriate nail care and foot care. So, like in the basics of foot care management, the presence of simple calluses, for example, are often neglected. So we see a lot of patients with that. They can start at calluses, that fissure or cracks have now portals of entry for infections. And then once they get infected, patients don't even feel it being diabetic until it gets worse.
And in a while, I understand, Doctor, we will be allowing Mr. Zuniga to experience the hyperbaric oxygen therapy here in St. Luke's.
Yes.
And now, nandito na naman tayo sa Hyperbaric Oxygen Therapy Room ng St. Luke's Medical Center in Quezon City. Kasama pa rin natin ang General Surgeon na si Dr. Efren Capistrano. Also with us, our patient, Mr. Salvador Zuniga, na may infected diabetic foot. So Doc, I think this is a really high-tech procedure that we can do for our patients with diabetic foot wounds or infections. How does hyperbaric oxygen therapy work?
Hyperbaric oxygen utilizes 100% pure oxygen, and it is delivered to patients under pressure. It is a very well controlled environment, and delivering pressure to patients enable the oxygen to be delivered to the needed tissue. In this case, patients with wounds, in particular those with diabetic foot ulcers.
Doc, just for reference, ang room air natin, ang normal amount of oxygen sa hangin, 21% lang, no?
Yes, actually 21%, and then there's about 78% nitrogen.
Okay.
But here in the hyperbaric, it's going to be not only 100% oxygen, but usually we put them under 2 to 3 ATA pressure.
Okay.
So that's like being at 3 ATA, it's like being 66 feet underwater.
Okay, yung pressure talaga para pumasok yung oxygen sa mga cells.
Yes.
Sir, ito po ba kailangan, pwede po sa any diabetic foot or may specific indication lang siya for diabetic foot?
Yes, because generally this will be more for complicated diabetic foot with usually defined ulcers. For those who classify it in technical terms, usually Wagner grade 3 or 4.
Okay.
So they are more complicated ones. So there are specific precautions and indications for hyperbaric. So it's not for all patients with diabetes.
So, Wagner 3 and 4, yan yung medyo malalim na po, Doc, no?
Yes.
So, Doc, si Mr. Zuniga, candidate siya for hyperbaric oxygen therapy. Paano natin piniprepare siya for the procedure?
Well, the preparation starts with a history, like previous surgeries, especially on the lungs, or in any procedure involving the ears, nose, and throat. Of course, the most basic, most important is starting with the vital signs. We check for the blood pressure, the temperature, because if the BP is high, that is one relative contraindication to doing the hyperbarics immediately. For those who are febrile, of course, the temperature has to be
May lagnat,
low.
hindi pwede.
Pagka may lagnat, hindi pwede yun. And then, we basically have to check also the ears and the sinuses, because the most common side effects of hyperbaric is what we call the ear squeeze or the sinus squeeze. It's just like what we experience when we are up in the airplane, and then we're descending or ascending. So that's why one of the things that we also make sure of is patients don't have any upper respiratory tract infection.
Okay.
They don't have colds. You have to check on their lungs that it is clear, and then that they don't have any indications of viral infection. So yung mga may sipon, may mga ubo, essentially we should cover them with decongestants before they're even put into the chamber.
How often do we do this po? Ano po yung interval?
Usually we can give it depending on the indication. There are so many indications. There are emergent acute indication like carbon monoxide poisoning. But for diabetic foot, we can give it at least usually 5 times a week.
5 times a week, madalas po.
Yes. And usually we give it for 2 weeks for initial effect. So that's about 10 doses. For effectivity, it's best to be given over 4 weeks or at least 20 treatment sessions.
So, matagal din, no? 20 sessions.
But with 50% reversibility, so it's good, no? This one.
We're able to prevent half of the amputations in our diabetic foot patients. We will be allowing Mr. Zuniga to experience the hyperbaric oxygen therapy. Abangan niyo po yan, mga kasambahay, sa pagbabalik ng Doctors on TV.
Magandang araw po mga mommy at daddy, mga kasangbahay. Ako po si Dr. Katrina Flor Cruz, isang pediatrician, at ito po ang Baby Talk. Tuturuan po namin kayo ng tamang paraan ng paggamit ng car seat at kung paano po ito i-install sa sasakyan sa pamamagitan ng tinatawag na rear-facing position na tulad nito. Ang rear-facing position po ay inirekomenda para po sa mga bata edad 2 years old pababa. Ito po ang car seat at ngayon po ito ay naka-rear facing position. Bago po kayo magsimula, lagi niyo pong babasahin ang instruction manual na kasama nito dahil hindi po lahat ng brands ay magkakamuka. Sa pamamagitan po ng rear facing position, masisiguro po natin na ligtas ang ating anak kung sakali pong may mangyari sa sasakyan. Ginamit po natin ang seat belt para po i-attach ang car seat dito sa sasakyan. Pagkatapos po, ang gagawin po natin, ikakabit din po natin yung mga buckles na kasama ayon po sa instruction manual. Pagkatapos mag-install, makakasiguro po tayo na tama ang ating pagkakalagay. Kapag ating inuga ang car seat, dapat hindi ito gagalaw. Pagkatapos po, siguraduhin din po natin na laging may kasama muna na adult sa loob ng sasakyan bago natin isakay si baby dun sa car seat. Yan po mga mommy at daddy. Pinakita po namin sa inyo ang tamang paraan ng pag-install ng rear-facing position na car seat. Muli, ako po si Dr. Katrina Flor Cruz para sa Baby Talk.
Do you want to know the exercises for urinary incontinence? Our women's health doctor will teach us easy-to-do steps to improve pelvic floor and women's health. Did you know that pure oxygen can hasten wound healing? Get the latest treatment called hyperbaric oxygen therapy. All these and more when Doctors on TV returns.
Magandang araw mga kasambahay. This is Dr. Steph Supan for another episode of Women's Health. Ang pag-uusapan natin ngayon ay tungkol sa mga pelvic floor disorders. Ano ba ang mga pelvic floor disorders? Ito ay ang mga kondisyon na tinatawag na pelvic organ prolapse at urinary incontinence. Ang mga pasyenteng may pelvic organ disorders ay kadalasang nagrereklamo na mayroong nararamdaman na bukol sa kanilang puwerta o kaya ay nahihirapang umihi. Ang pelvic floor ay isang grupo ng muscles na nagfo-form ng duyan sa ating balakang. Ito ang sumasalo sa ating mga abdominal organs at ito ang muscles na nakapaligid sa daanan ng ihi, daanan ng dumi at sa puwerta. Pag nagkaproblema ang pelvic floor muscles na ito, ay maaaring bumaksak ang matres at magkaroon ng problema sa pag-ihi. Ang mga problema sa pag-ihi ay maaaring iba-iba. Mayroong nahihirapang lumabas ang ihi at kailangan pang umire bago sila makaihi. Ang iba naman ay hindi mapigilan ang kanilang pag-ihi, lalo na kung sila ay umuubo, tumatawa o nagbubuhat ng mabigat. Mayroon naman na sobrang dalas umihi o kaya ay kapag naramdaman na ang urge na umihi ay hindi na mapigilan ito. Lahat ito ay forms ng urinary incontinence. Maraming possible causes ang urinary incontinence. Una dito ay congenital. Maaaring ipinanganak na ang isang babae na may weakness o pagkahina ang kanyang mga muscles sa pelvic floor. Mayroon din namang mga kondisyon na maaaring brought about by obesity o labis na timbang o kaya ay pagbubuntis at childbirth. Nandito ngayon tayo sa Center for Pelvic Organ Disorder and Anorectal Diseases sa St. Luke's Medical Center. Ipapakita namin ngayon kung papaano ginagawa ang urodynamic studies. isa sa mga tests na maaaring gawin sa mga babaeng may pelvic organ disorder. Ang urodynamic studies ay ginagawa sa mga babaeng may pelvic organ prolapse or urinary incontinence para ma-identify mismo kung ano ang problema sa kanilang pag-ihi. Kasama po natin ngayon si Riza dito sa Center for Pelvic Organ Disorder and Anorectal Diseases para ipakita sa atin kung paano ginagawa ang test na ito. Hi Riza! So pwede mo bang ipakita sa amin ngayon kung paano ginagawa itong urodynamic studies na test?
Ang urodynamic study ay isang komprehensibong diagnostic procedure kung saan ine-evaluate ang proseso ng pag-ihi ng pasyente. So mayroong dalawang parte ang urodynamic study natin. So sa unang parte, iihi ang ating pasyente dito sa ating receptacle or commode na nakakabit dito sa ating machine. Sa babae, umiihi siya ng nakaupo. Sa lalaki naman, itataas itong receptacle na to at iihi siya ng nakatayo. Sa pangalawang parte naman ng ating urodynamic study, ang ating pasyente ay hihiga sa kama na kung tawagin nila ay urodynamic bed. So dito nakahiga ang pasyente, nakabuka ang kanyang paa, tapos may mga ilalagay kaming catheters. Una, catheter sa daanan ng pag-ihi, kung saan tinitignan nito kung may lakas ang kanyang pantog o bladder para mailabas ang ihi or maipiga ang ihi palabas. Pangalawa, rectal catheter o catheter sa puwet. Dito naman natin makikita kung ang pasyente ay umiiri para lang makalabas ang ihi. At ang pinakahuli, stickers o electrodes kung tawagin nila na ididikit natin malapit sa butas ng puwet ng pasyente. Ang tinitignan nito is yung sphincter ng ating pasyente. Kapag nakakabit na lahat ng catheters, pati yung sticker, ikakabit natin siya sa ating machine. During urodynamic study, maglalagay ang ating machine ng tubig sa pamamagitan ng mga catheters na nakakabit sa pasyente at nakikita na sa ating graph kung paano ang proseso ng pag-ihi ng ating pasyente.
Pagkatapos magawa ang urodynamic studies at na-identify na kung anong klaseng urinary incontinence mayroon ang isang pasyente, maaari na tayong mag-decide kung ano ang treatment na kanyang kinakailangan. Ang treatment for urinary incontinence ay maaaring medical o gamot lamang, maaari itong mga exercise kagaya ng Kegels exercises, or ang iba naman ay nangangailangan ng surgery. Sa ating mga kasambahay na nakaka-experience ng problema sa pag-ihi, magandang kumonsulta sa inyong doktor at huwag tiisin na may problema sa pag-ihi. Ayan mga kasambahay, sana ay marami kayong natutunan ngayong araw na ito. Hanggang sa susunod na linggo, this is Dr. Steph Supan for Women's Health.
And welcome back mga kasambahay to Doctors on TV. And of course, to help us prepare Mr. Zuniga for the procedure, we have our two nurses here. This is Mon Onkinko and Chapi Akoba. So how do we prepare our patient? Doc, importante ang BP kasi pag mataas ang BP, hindi pwede mag-hyperbaric oxygen therapy.
Yes, because the effect of hyperbaric is a vasoconstrictor.
So Doc, after initial evaluation, candidate ba si Mr. Zuniga?
Well, yes. We've done chest x-rays already. It was found to be normal. And then all the initial physical examinations on the ears, sinus, and lungs, the vital signs are normal. So I think Mr. Zuniga is ready for our hyperbaric chamber.
So, let's see how it's done.
Okay. Mon,
Okay.
yeah, please.
Meron po tayong kailangan gamitin just in case for emergency. So, ilalagay nyo lang po ito sa ilong na kagaya ng ganito. Pagkatapos po, hihinga po kayo dito. So, ituturo po namin sa inyo kung paano po gamitin habang nasa loob na kayo. Itatapit ko po muna dito sa...
Hawakan na po ninyo.
Hawakan nyo lang po. po, papasok na po tayo.
So right now, Mr. Zuniga is on room air.
Okay.
There's no pressurization yet.
And slowly, you'll be increasing the oxygen levels.
Yes, actually, Mon has started a timer. So Mon is able to directly communicate with our patient, and there's a sound system that he can be heard.
Okay.
So that's the advantage of the acrylic chamber. It's you can see in and out. The one that we have in global is actually bigger, so that it's less claustrophobic. And you can see here we started from sea level 180A, and oftentimes we keep the pressure between 2 to 2.5. We rarely go beyond 380A.
Okay.
That is atmospheric pressure. Now, this is what we call a monoplace chamber. Monoplace because only one patient can obviously go inside. Other centers, especially in the States, have multi-chambers.
Okay.
And it is in those chambers wherein they can raise even the pressures beyond 380A. Ordinarily, we also have the patient enjoy a DVD movie.
Okay.
They can also be given music inside so that while having the treatment, which usually lasts for about 60 to 90 minutes,
Okay.
it depends on the protocol for the particular indication for the hyperbaric.
So 1 hour siya nandun, or 1 hour and a half.
Yes, that's the usual time.
And he doesn't expect to feel any discomfort inside.
They do. That's why the treatment, we teach the patients how to equalize by knowing how to blow their nose, much like when you're descending or ascending the plane.
So yung ears nagpa-pop.
Yeah, when your ears pop or you feel that ear squeeze.
Doc, I understand that with hyperbaric, there are other indications. But how do patients get referred to this kind of treatment? Like other indications, like I heard okay daw po sa stroke, pero paano po sila marirefer na mag-hyperbaric?
There are what we call primary indications for hyperbaric. The most common that probably we know is decompression sickness. So that's when divers get the bend. This is the month of fires. So one of the other primary indication is carbon monoxide poisoning. And then the other one is gas embolism. So those were the primary indications before. There are other indications, secondary indications. So there are actually 14 indications. 9 of them are related to wounds. And one of them specifically is on diabetic foot ulcers.
All right. And what other wounds could benefit with hyperbaric oxygen therapy?
So like osteomyelitis,
Okay.
necrotizing fasciitis, okay, and we can have also deep soft tissue infections.
Dok, napansin ko kanina, pag may infection, mas maganda mag-hyperbaric.
Because like in diabetes, in all of these circumstances, oxygen has a big role. So in neuropathy, usually, it's a little bit deep-seated, but it's with regards to the blood supply to the nerves. So if there's not enough blood supply to the nerves, then the nerves don't function as well.
Okay, so Doc, it's been 60 minutes. I think it's time now for Mr. Zuniga to come up. One. So how was it, Mr. Zuniga? So Doc, post-treatment, ano ba advice natin kay Mr. Zuniga when he goes home?
Well, of course, they have to relate to us if they have any form of aches or pains, especially with regards to breathing problems. They have to report to us. And then, of course, there are need for continued wound care. Mr. Zuniga needs continued wound care.
So thank you very much, Dr. Capistrano, for all the information you've given us. I'm sure it's really very helpful to our viewers to learn a lot about diabetes and foot infections and how we can use hyperbaric oxygen therapy. Ano pong final words sa audience natin?
Well, it's a pleasure to have shared our center and hopefully the center can deliver its role to the public that we can prevent a lot of amputations, which is one of the core objectives of our center. And if you have any need of our service, we have Chappie and Mon with us. Kindly call us at 723-0101. And through our operator, get connected to our Hyperbaric Oxygen Therapy Center and Wound Care Center all at the same time.
Okay. And you have one here in Quezon City. You also have one in Global City.
Yes, and equally as good. The chamber in Global is bigger, but surely the services will be as excellent.
Doc, lastly, anyone you want to greet po?
Well, I'm with the family of St. Luke's Medical Center, and I'd like just to greet my two kids, Jed and Jeff. Hope you're having a good day there.
Okay, thank you again, Dr. Efren Capistrano of St. Luke's Medical Center. Of
Thank
course,
you, Doc.
thank you also to our nurses, Chappie and Mon, for helping us this morning. Wag muna kayo alis mga kasambahay, magbabalik po ang Doctors on TV. At nagbabalik mga kasambahay ang Doctors on TV. Dr. Casey, very productive episode again.
Yes, we learned so much.
Oh, lots to learn really about wound care. No? A simple wound can later grow to be something bigger na pwede nga umabot sa amputation.
Yes.
O kaya naman po mga kasambahay, be very careful with your foot wounds. Take care of your feet always. Make sure your diabetes is controlled para hindi po masira yung mga ugat na nagdadala ng oxygen tsaka pagkain sa dulo ng paa, sa mga daliri.
Actually, diabetes po is very common. But the problem with diabetes, yung po mga tao, hindi po masyado naaalagaan. So you really should be careful on how you treat your diabetes or how you manage your diabetes. And for example po, yung skincare natin, medyo mahirap din po with skincare sa diabetes. Kasi minsan po, nakakalimutan natin na kahit konting hiwa sa paa natin o sa skin, pag po may diabetes tayo, hindi po siya madaling gumaling. So, mas maganda po kung iingatan po natin at alam po natin yung proper way ng pag-alaga po dito and pag-treat po.
Tama yan, Casey. Okay, I'd like to thank you for joining us on this episode. We'd also like to thank, of course, St. Luke's Medical Center, Hyperbaric Oxygen Therapy. For inquiries, you can call them at 723-0101 or 723-0301, local 4186. You can visit the website at stlukesmedicalcenter.com.ph or visit their Facebook page at facebook.com/St. Luke's Medical Center Official. Of course, we'd like to thank the President and CEO, Dr. Edgardo Cortez, and their Medical Director, Dr. Jose Moran, and our friends from Marketing, Ms. Josephine Aguilar, Mr. Gary Candelaria, and Mr. Jude Trinidad. Of course, thank you also to Fiber C, the only natural real vitamin C, also to San Isidro House of Healing and LRT Integrative Center. Dr. Casey?
Wow. I'm really happy that I'm with you here in St. Luke's. A very productive topic. I also learned as a doctor, I know some areas about wound care, pero nakatulong din ngayon yung event natin today. At least mas marami pa akong natutunan as a doctor.
Oh, not just as physicians, but even on a personal side, no?
Yes.
These topics can be very helpful to
Yes.
us. Okay, so mga kasambahay, until next week, be safe and stay healthy. Magkita po ulit tayo sa susunod na linggo dito lamang sa
Doctors on TV.